My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk. What was that all about?
Jamaican chicken recipes.
Ain't nobody got time for that.
Bronchial Asthma by Jody Holland. Ever hear the term bronchial asthma and wonder what it means? When people talk about bronchial asthma, they are really talking about asthma, a chronic inflammatory disease of the airways that cause periodic attacks of coughing, wheezing, shortness of breath, and chest tightness.
Couldn't stop coughing. It was exhausting.
There were people all around me, but I couldn't get the words out.
I was fighting for each breath. I felt like I was drowning.
The wheezing made me feel like I was breathing through a straw.
It felt like an elephant on my chest.
When I saw my little girl's lips turn blue, I knew it was an asthma attack.
It was scary.
Painful.
Frightening.
Traumatic.
Asthma kills one person every week in Ireland.
The etiology of bronchial asthma is multifactorial, involving a combination of genetic predisposition and environmental triggers.
Asthma we see is based on a long-time family history of asthma and potentially allergies.
There are probably multiple different forms of asthma, and there's some of them that have to do with environment and allergy. Some of them seem to run in families and have a genetic component to it, and other times it pops up out of the blue.
The body senses different, what we call antigens, which can be anything from dust or smoke or cat hair or things along those lines. And the body treats this as if it's a foreign invader.
It's part of our job to sort out what's triggering the asthma, how do we potentially intervene and eliminate that exposure to try to improve asthma health overall.
Asthma is marked by airway inflammation and remodeling, including goblet cell hyperplasia, subepithelial fibrosis, collagen accumulation, larger mucosal glands, smooth muscle hypertrophy, and changes in the extracellular matrix. These alterations can disrupt immune balance and increase airway responsiveness. Additionally, bronchial asthma involves changes in transcription factors, inflammatory mediators, chemokines, cytokines, and proteins regulating cell death and growth.
Does it mean?
It means that bronchial asthma is a chronic condition marked by persistent airway inflammation, causing narrowing, increased sensitivity, and increased mucus. Both genetics and environmental factors contribute to its development. Immune system release substances that trigger these symptoms, and ongoing inflammation can thicken airways and decrease lung function over time.
Millions of people live with asthma, and yet many of them don't know it. It is one of the most common conditions among children. Unfortunately, it is also often unknown, underdiagnosed, and undertreated. Here to talk about it is Dr. Sarah Rylance. Welcome, Sarah. How would I know if I have asthma?
So asthma is one of the most common chronic conditions, and it affects the airways in our lungs. These airways are a network of dividing tubes, and they become smaller and smaller the deeper into the lungs that you go. People who have asthma have particularly sensitive airways, and they can become narrowed from time to time, either due to a tightening of the muscles that surround the airways, or due to swelling or inflammation of the lining of the airways. When the airways become narrow, then this causes symptoms, so cough, difficulty breathing, and wheezing. These symptoms are not there all of the time, they come and go, but they're often worse at night or worse with exercise.
Over 250 million people worldwide have asthma, according to the Global Asthma Network and WHO, making it a major health issue. Asthma is especially common in children. The CDC reported that 7.5% of U.S. children aged 5 to 11 had asthma in 2021. The number of global asthma cases is projected to increase by 2025. So normal treatment course. After diagnosis, your provider may prescribe inhalers or pills and suggest lifestyle changes. Long-acting inhalers control inflammation, while rescue inhalers quickly relieve attacks.
Sarah, what are the treatments for asthma?
Asthma treatments work in two main ways. So one is to open up the airways when they become tight by relaxing the muscles. This type of medicine is called a bronchodilator or a reliever or rescue medicine, and it can be life-saving if symptoms are very severe. The second type of treatment is a steroid medicine, and that works to reduce the inflammation or the swelling inside the airways. It's just as important as the bronchodilator. Both types of treatment should be given by an inhaler. This is the most effective way to get the medicine into the airways in the lungs, which is where it needs to be. Even though asthma is common, and these two types of treatments have been around for a long time, WHO data shows that essential steroid inhalers are only available in about 40% of low and low-middle income countries. So we know that many people still use old-fashioned and inappropriate treatments such as syrups or tablets instead of inhalers, which are less effective and they have more side effects.
In Canada, massage therapy is generally safe for people with asthma and may help manage symptoms by promoting relaxation and improving breathing, which could reduce the need for rescue inhalers. Massage can complement asthma management, especially when symptoms are mild or during flare-ups. Beneficial techniques include Swedish massage promotes relaxation, deep tissue massage relieves muscle tension, and lymphatic drainage massage reduces swelling and improves lymph function. Massage therapy treatment modifications and considerations. Determine the patient's asthma triggers and remove if present. Do not exhaust with over-treatment, painful techniques. Avoid compression of the xiphoid and floating ribs. Avoid the prone position if breathing is restricted. Semi-reclined or a side-lying position is preferred. Treatment during acute attack is contraindicated. Postural drainage with severe conditions of the heart and lungs. Tapotement over bony prominences. And ask the client if osteoporosis is present. Thank you for watching my presentation. Please feel free to ask me any questions or comment on my presentation.